as someone who had dedicated their life to becoming a doctor and to providing healthcare for the entire community, I couldn't just stop thinking about it.
Here's Dr. Daniel Nour.
Dr. Daniel Nour. I am a Cardiology Advanced Trainee at Royal North Shore Hospital, and I am also the founder of Streetside Medics. Streetside Medics is a mobile medical service providing GP-led care to people experiencing homelessness. We essentially are a van that we've fitted out as a customised medical clinic, and we take that clinic to food services and shelters across New South Wales and now Victoria, and we provide free medical care without the need for documentation, ID, or a Medicare card. There are a number of barriers that limit access to healthcare for people experiencing homelessness. That can include level of documentation and ID, transportation, previous negative experiences, stigma and embarrassment, but certainly an important one is health priority. What we've learnt is that people experiencing homelessness may be more concerned with where they're sleeping, shelter, food, security, companionship, and not so much why they might be short of breath or why their stools may have turned black. And so their health priority certainly falls low when it's compared with things like their security or food. The Streetside Medics was started after a personal experience in London with a gentleman who I learnt was experiencing homelessness, who was having a seizure. And through that interaction and a conversation with some of his friends afterwards, I learnt of the challenges that they experience in accessing healthcare. And coming back to Australia, I did my research and learnt that despite having what I believe is probably the best healthcare system in the world, we have a number of significant and challenging barriers that limit access to healthcare for people experiencing homelessness. And that's why Streetside Medics was established, to provide a clinical service to people experiencing homelessness in an environment that they're comfortable with and an environment that's familiar to them. But also we leverage on opportunistic healthcare. Most of our patients are likely going to these areas for food, and so we just so happen to be parked there, and we try and alleviate the barriers that would limit access to our service, and therefore they can come and access it. I think my personal passion comes from a few different places. I'm a person of faith, of a Christian background, and so I believe it's our obligation on this earth to do everything we can to live a good life and to give back to our community, and certainly to people who might be less fortunate. And I think as a clinician, we all do it for one pure reason, and that is to improve the lives of people in our community and to have a positive contribution to society. So Streetside Medics started its operations in about August 2020 and has been operating since then. We now have 10 clinics across New South Wales and our first clinic in Victoria. We have 600 volunteers on our books, of which about 250 are active, and there's actively working through the rest of the volunteers to give them volunteering opportunities. We see on average anywhere between 10 to 20 people per clinic per night. And what we've noticed is that really varies with the season and the weather. Of course, as you can imagine, if it's rainy outside, we're less likely to see people. If it's a nice, warm, sunny day, we're more likely to see people. Of course, if it's cold, we see a different demographic of people versus if the weather is good. The photo on the left shows our medical support officer station. This is where a patient will come in. They'll get screened by either a nurse or a junior doctor. They'll get a brief history. If they need to get a set of vitals, they'll get that. If they need a blood test, they can have that. And if they need a vaccine, they can have it. And just a small illustration of the benefit of technology for a service like Streetside Medics. New South Wales Health Pathology, when we first started, had received this machine. I don't remember the name, so I apologise, but it was point-of-care testing that had allowed us to get a full blood count from a VBG within about a minute. We also had a machine that could give us a HbA1c from a finger prick within about 120 seconds. And so you can imagine, for people that we see who may be at risk of diabetes, being able to come into that van, identified as being at risk of diabetes, with a single finger prick, we could definitively tell them, you have diabetes, here is a diabetic care plan, here is a box of metformin, and they leave that van, yes, with a medical problem, but with a solution, with a tangible, positive solution that could see their life and the complications of diabetes changed. And similarly with the other machines available there. From its inception, Streets Out Medics has recognised the capacity for medical technology to have a huge positive impact on our services. We were one of the first in Australia to receive point-of-care testing that was able to give us a full blood count from a simple VBG, as well as a HbA1c and an INR within a few seconds from within our van. The impact that has is huge. We're able to see people for the first time and tell them definitively whether they have a condition such as diabetes, and we're therefore able to see it through by giving them a GP diabetic care plan and potentially some medication to start their journey of diabetes. Medical technology has been one of our biggest assets, whether it be our medical equipment such as a ultrasound through a little tablet provided to us by Philips, whether it be our otoscope, ophthalmoscope, dermatoscope, but having all the things that we're used to in our clinics within a van setting that is portable, small, and yet still phenomenal has really transformed the way we deliver healthcare and really improved our clinical service. This was taken a few weeks after the floods. I remember when the floods occurred, I called the Minister to the Prime Minister, Ben Mortimer, and I said, "We'd love to support. Is there any way that we can help with the floods?" And he said, "Daniel, I'm not sure. Let me get back to you." And I had a friend of mine who was doing a rotation at Lismore Hospital. And he told me about this 86-year-old lady who presented with a significant stroke. But that was in the context of having a metal valve, a metallic valve, and being unable to see her GP to get a script of her warfarin. A direct consequence of being unable to see her GP, she now had likely life-threatening and long-lasting neurological complications. And so we very quickly realised, especially in a community like Lismore, how important it is that the doctors have access to their patients and that patients have access to their doctors. And so the next day, 2 of our amazing volunteers drove the van from Sydney to Lismore and provided it to the various different medical centres across the region until their services were back up and running and ready to be in operation. The example of Streets Out Medics responding to the Lismore floods and providing our van to the local GPs to continue delivering their clinical services, I think is quite an important one. Certainly it's not within our vision to be providing emergency response to people in emergency circumstances, but what we do know is that it's absolutely essential for general practitioners to have access to their patients, and more importantly for patients to have access to their general practitioners. And so in the context of emergencies, Streets Out Medics is certainly willing and able to provide our clinical vans so that the community can continue to have their essential clinical services. I've been so moved and blown away by the generosity of the people who volunteer for Streets Out Medics, who rock up week in, week out, dedicate their time, generally on top of their very busy lives, whether that's clinical or non-clinical, to support the work of Streets Out Medics. And I believe the reason is twofold. Firstly, it's always rewarding to use your professional skills to give back to the community. And so I think for a number of our healthcare professionals, being able to use the skills that they have and that they use every day to give back to the community is a huge value add for them. But I think the second thing is it's the feeling you get during a clinic. We all want to help people, but we certainly want to help people who might not be able to access that help. I know that if I don't go to my hospital, for example, that they'll still receive exceptional level of care. But when you go to a Streets Out Medics clinic, you become aware that if you weren't there, it's unlikely that person would receive the level of care that they deserve. And so I think it's an extremely fulfilling feeling to know that you're not only delivering exceptional care, but you're doing it to people who truly need it and who may otherwise not have anyone to turn to. And so I think that's truly driving people's involvement with Streets Out Medics. And my biggest call to action would be for those clinicians out there who may have some time on their hands and want to give back to the community to reach out to Streets Out Medics, whether you're a specialist, whether you're a general practitioner, whether you're a junior doctor or a nurse. We have roles that would suit anyone. We're actively growing across the country and always need dedicated health professionals who are willing to give their time, skills and resources to support us.